I'm Anna Barac. I'm a cardiologist with MedStar Heart and Vascular Institute in Washington, D.C. and I'm Associate Professor of Medicine with Georgetown University, also in D.C. I am at Cardiometabolic Health, Women's Health Summit, and I was delighted to be able to present on cardiovascular health and disease in patients with breast cancer. I thought that this discussion was extremely timely, given that cardiovascular disease is the second leading cause of death in this growing number of breast cancer survivor population. Breast cancer and cardiovascular disease share a number of common risk factors that we need to learn better how to address to prevent both cardiovascular disease as well as breast cancer recurrence. At present, we recently had a number of professional societies addressing cardiac dysfunction risk that can arise as a consequence of different cancer treatments. This was an important step to move us forward and understand mechanisms of cardiovascular injury that happen in the setting of the treatment. However, when moving forward, I think we need to think beyond cardiac dysfunction alone. A number of important insights from epidemiology studies tell us that cardiac function alone does not capture the entire spectrum of risks that breast cancer patients may be affected with, and I think the future research needs to go down that path. Current recommendations tell us how to look for and evaluate for evidence of cardiac dysfunction during cancer treatment. What is critical and needed at this point is really long-term follow-up in these patients. We need to understand their baseline risks better, and we need to follow them for a long time to understand what is happening not only with cardiac dysfunction, what is happening with functional capacity, with overall cardiovascular risk, including the risk of myocardial infarction, of heart failure with preserved ejection fraction, as well as cardiometabolic health in general. I think that collaborations with investigators in the space of cardiometabolic health will importantly inform potential intervention trials in this population and ultimately improve health.